This is Professor Michael Chapman. I'm one of the most experienced IVF doctors in Australia. I believe that an important part that I can contribute is to educate patients in relation to fertility, infertility, and all that involves. These series of podcasts help to educate you. I hope they are helpful to you. If you wish to know more, however, I'm more than happy to have you contact me via email, which is profmchapman@gmail.com, or make an appointment to see me on 9138 4222.
I have a script for Slinda to take to manage my endometriosis. Do you suggest taking this while breastfeeding, or would it be better to wait for my period to return before starting it?
No, I think it's fine to take during breastfeeding. It's a progestogen. We worry about estrogen pills while you're breastfeeding because it can suppress the breast milk production. But the Slinda's a type of progestin, and it seems, in fact, to be a better option than what we used to be called the progesterone-only pill. It's slightly stronger in its dosage, and the data is very supportive of it being helpful in endometriosis. And as I say, progestins don't affect your breastfeeding.
The question is, are there specific risks for women with PCOS undergoing IVF?
The risk is they'll get pregnant. If I see a woman that has PCOS and they need IVF, and I say if they need it, because unless there's a sperm problem or a tubal problem, treating PCOS to produce a pregnancy is much better done by simple medication. That if the problem because of your PCOS is that you're not making an egg, then using tablets to stimulate ovulation to get you back to a normal rate of conception is the way to go. It takes longer probably than an IVF cycle in the sense that all we're doing by making you ovulate is take you back to being normal. So what's normal? Normal is, if you're under 38, around about 15% chance per month of, if everything else is normal, sperm's normal, tubes are open. If we can induce ovulation, we're going to give you 15% per month on an ongoing basis. 15%, as I explained to patients, is actually 1 in 6. And if you think about a dice, if you keep rolling a dice, eventually you'll get a 6. You might get it in the first throw of the dice, but certainly by 12 throws of the dice, you've got over a 90% chance of a pregnancy without having to go through IVF. I'm afraid many of my colleagues move too quickly to move patients into IVF when they've got polycystic ovaries, when there are simpler treatments. It's expensive, invasive, and for vast majority of patients, I would not recommend starting off with IVF. Obviously, impatience comes into play because by 6 months, you've got a 60% chance of being pregnant if we get you ovulating regularly. But that means 40% of that are still not pregnant at 6 months. And that 40%, I have to say, when they come to see me, after I've been encouraging them to be patient, they usually champing at the bit and we give in. But I still think it's important to give ovulation and nature a good chance to get a pregnancy, not to rush into IVF.
And don't forget that you can access all the previous episodes by going to our website www.theivfjourney.com and select IVF Journey podcast from the navigation menu.